at UREC, we're trying to help other people, including our loved ones and people across the country and now across the world, understand what quality is like. And that's what the UREC star is supposed to mean, is that somebody has come in and actually checked them for their work. So thank you for answering this question on the poll. Let's go to the next slide. So when we think about pharmacy quality, okay, so pharmacies have been around for a while, and URAC is one of the longest, or has one of the longest tenures of measuring pharmacy quality. So we measure pharmacy quality in practice. We want to make sure that measure sets are based on things that pharmacies can actually report reliably. Because if you report measures and they're like for 6 of your patients, and somebody looks at those measures and says, well, they've got 600 patients, but they're doing terrible on this one thing because the measures don't actually capture the full scope of your practice. The reliability of a measure is very important, and we try and focus on measures that reflect performance of a pharmacy, not just performance with 17 patients or 40 patients or something like that. Because if you're going to use measurement to tell the story as to how your pharmacy is doing, we want to make sure that it's an accurate story. We want to give chances for you to highlight the work that you're doing. If you're having problem with a measure and you're starting off really low and you get 5 times better, you still may be below somebody who started off really high or has a really controlled population or those sort of things. So we really think that continuous quality improvement is a function of an organization. When you're actually taking measurement, you're analyzing it, you're looking for your opportunities, and you're moving forward. And if you keep doing that long enough, you're going to be fantastic. And we think that's really important. We also think that if you take a look at measures over time, they start off being sort of process measures, where you're looking at, how did we do with this one little piece of delivering care? And they kind of expand over time. And what you want to do is you want to grow from where you're measuring a process to where you're measuring an outcome. Because more and more people, when they're paying for services and when they're receiving healthcare, they want to know how the outcomes are. And if you're just still talking about a process measure, then you're not speaking the same language that people are looking for. And so we try and move along. If you look at us over the years, we have moved from more process measures to more outcomes measures, and we're going to continue to grow it and move in that direction.